affects more than 64 million individuals worldwide. Previous study findings suggest that depression, anxiety, and low social support are associated with poor prognosis in heart failure patients. Along with the patients, it affects devastatingly to the family members. Hello and welcome to Medical Dialogues, your daily dose of health and medical news. I'm Mr. Zaman, and today I'm going to discuss about how death of a close family member increases the risk of heart failure. Heart failure patients experiencing grief or in mourning following the loss of a close family member are at an increased risk of death, particularly during the first week following the family member's death, according to a study published in JACC Heart Failure. Many studies have also been conducted to confirm the relationship between severe emotional stress and Takotsubo cardiomyopathy, also known as broken heart syndrome. The study is one of the first to investigate the association between bereavement and heart failure risk. The study authors looked at almost 5 lakh patients from the Swedish Heart Failure Registry during 2000 to 2018 and/or patients with a primary diagnosis of heart failure from the Swedish Patient Registry during 1987 to 2018. Information on date and cause of family member deaths, that is children, spouse, partner, grandchildren, siblings and parents, was obtained from the cause of death register. A total of 58,949 participants experienced bereavement during the mean 3.7 years of follow-up. The association between bereavement and increased heart failure mortality risk was observed after death of a child, which was a 10% increased risk, spouse, partner, a 20% increased risk, grandchild, a 5% increased risk, or sibling, a 13% increased risk, but not after death of a parent. The risk of dying from heart failure after the loss of any family member was highest during the first week of bereavement, a 78% increased risk, particularly in the case of a death of a child, a 31% increased risk, or spouse, partner, a 113% increased risk. It was also higher in the case of 2 losses, a 35% increased risk, as opposed to 1 loss, a 28% increased risk. The association between bereavement and mortality was not only observed in cases of loss due to cardiovascular disease and other natural causes, but also in cases of unnatural deaths. These findings point that bereavement was associated with mortality in heart failure patients, which contributes to and extends the existing literature regarding role of stress in prognosis of heart failure and is consistent with studies reporting associations between bereavement and increased risk of incident cardiovascular conditions, the researchers concluded. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.